I was first diagnosed in the fall of 2005. As it turns out, I have very dense breast tissue, and for many years the doctors had seen calcifications on my mammograms. So I was being brought in on a reduced schedule, and finally a radiologist decided that he saw a suspicious area of calcification, wanted to do biopsy. And so we did that, and it came back as a diagnosis of invasive ductal carcinoma. Once the surgery was complete and the pathology report came back, there was a big surprise. The tumor was considerably larger than we anticipated, even though I'd had, ultrasound and breast MRI and all of the other imaging indicated that it was small. It was not small. The prospect of chemotherapy was very daunting for me. It was just like the wrong time and the wrong circumstances. Fortunately for me, my physicians, both the surgeon and oncologist, knew about the Oncotype DX test. So we did send off my tumor for testing for analysis of the tumor's RNA. And fortunately for me, the test results came back. I had a very low recurrence score, a score of 9 on their scale. And my oncologist put the data into her adjuvant online computer program, along with information about my tumor and other information about me, and showed me that as a result of this test, we could feel confident that chemotherapy would really not give me any incremental benefit over taking tamoxifen for 5 years. And it did give a 1% incremental benefit, 10-year survival benefit. It added 1% to my survival time. That obviously was not enough to even think about the risks of chemotherapy. So both my oncologist and I confidently made the decision, to skip chemotherapy. And that was a huge relief for me. So indeed, by the time those results came back, I was already recovered, in large part from my surgery, which meant that I could go on with my life. I didn't have to worry about the rigors of chemotherapy. So it was at that point where I sat back and said, wow, this is just an incredible technology, and I want to learn more. And I ended up learning a lot more about personalized medicine, and I realized that my story was just one small story in this, this huge novel still being written about the benefits of genetics, genomics, and personalized medicine. I remain diligent about cancer. Any cancer survivor is, but I have to say that all things considered, having surgery, having this result, I feel like I'm cured of my cancer. I know as a cancer survivor I have a greater likelihood of other cancers, and so I remain diligent. But the peace of mind, the fact that I didn't need to have chemo, I started a course of hormone therapy, tamoxifen. Some women have bad side effects from that. I had no side effects from that. So it was a happy ending, if you could have a happy ending. I think from the genetic test standpoint, I don't think I could have been managed better. To have my surgeon mention it, even before the tumor was out, was great, kind of set me up for, what was out there, depending upon the result. And that, as soon as the path report came out and we realized we could be facing chemotherapy, we implemented that decision. I'm looking forward for the day when my tumor would have been analyzed, not after it came out, but when my DNA, if we could have analyzed my DNA from my biopsy sample, if I had had the information that I have now, that it was unaggressive tumor, clearly fueled by estrogen, because once I was on an estrogen patch, I came of age in the, when birth control pills were first out, and I probably took those for 20 years, so my life was filled with estrogen. And when I went back for mammogram on my remaining breast a year later, and all the estrogen was out of my life, my radiologist said she could definitely see the difference in that breast. A lot of things had quieted down. So I would say that there's a day, I'm hoping, when the DNA is analyzed from my biopsy sample, and that information might have encouraged me to watchfully wait on that tumor as opposed to going forward for surgery. Now, when I mention that to a lot of physicians, they get pretty upset with me. But I've had others say that that's not an uncommon choice of women in Europe, you know, that will tend to watchfully wait tumors. That's not the culture of this country currently. So I'm looking forward for the day when we give women more options.